In this video, I'm going to be telling you the difference between polycystic ovarian syndrome and ovarian cysts. For you to understand it very well, I would want you to please do two things for me. One, watch my previous video on ovarian cysts. That will help you understand what ovarian cyst really is, so you can compare it with this particular one, which is polycystic ovarian syndrome. Also, watch this video till the end because I'll go in details to explain what polycystic ovarian syndrome is, the causes of PCOS, and also the symptoms to expect when you've got polycystic ovarian syndrome. I'll go ahead to explain the treatment options that are available for people with this disease condition and then explaining the differences between them. If this sounds interesting, please keep watching till the end. Also, do not forget to like, share, and subscribe to my channel because that's your own way of supporting me and showing me that you truly understand and like what I'm doing right here. Okay, so let's get started. What happens in polycystic ovarian syndrome is that the female reproductive organ, which is the ovary, which usually secretes a little amount of the androgens, which are male sex hormones, now begins to produce a slightly higher amount of these androgens, and this leads to lack of ovulation or irregular ovulation. Now, in this situation, this woman usually presents with various symptoms, and most of the time, it is diagnosed when this woman presents with infertility. Having come to know that polycystic ovarian syndrome is caused by the excess production of male hormones in the female reproductive organ, now, let's talk about the symptoms. One of the symptoms which women with PCOS usually presents with is missed periods or irregular periods. So in this situation, the woman does not ovulate and this makes her not to be able to menstruate. Another symptom that these women present with is that they usually have a lot of cysts in their ovaries, and this is usually detected when an ultrasound scan is done. Then the next symptom is acne and oily skin. This is also followed by other symptoms such as hair thinning, and in some circumstances, these women also present with hair loss. Next is weight gain, and this weight gain is usually around the belly area. This is followed by infertility. These women usually have problem conceiving. The next is insulin resistance. In this situation, these women present with high levels of sugar in their blood. And then last on the list is excess hair growth, especially in areas where men are expected to have hair. So most of these patients usually present with hair around their beard area, hair around the chin, also on their back, sometimes on the nipple and the abdomen. So these are the symptoms to expect when a person has PCOS. So in order to actually make a diagnosis of polycystic ovarian syndrome, doctors usually look out for what we call the 2 out of the 3 major symptoms in polycystic ovarian syndrome. And this they do using what we call the Rotterdam criteria. So in this situation, the 3 symptoms I'm going to be explaining now is what I've already talked about. That is irregular periods or no periods, large number of follicles in the ovary, and high levels of testosterone. So if a woman has 2 out of these 3 or all 3, then it has been diagnosed that the patient has polycystic ovarian syndrome. So let's go ahead to talk about the treatments. In the treatment of PCOS, the decision is based on what the woman wants. Your doctor will discuss with you if you are trying to get pregnant or you simply want to get rid of the symptoms. So based on what you want, a treatment plan will be made for you. So for instance, if the woman wants to get pregnant, the treatment could be recommending that she tries to lose weight if she's overweight or obese. So trying to lose weight means getting, enough exercise and also eating healthy diets. So this will help her to lose weight and also help to manage the problem of insulin resistance. By doing all of this, she will be able to ovulate. We can also use medication in the treatment of PCOS. One of the medications that is usually used is clomiphene. It is the treatment of choice in PCOS for women who are trying to conceive. So this medication actually helps to induce ovulation. So when ovulation is induced, this increases the woman's chances of getting pregnant. Another medication that could be used is metformin. Metformin is actually used in the treatment of diabetes. However, it has been found out that it also helps to induce ovulation, just like clomiphene. But while I was researching on this topic, I found out that in the United Kingdom, where I am, the use of metformin is not licensed in the treatment of PCOS unless it is used as an off-label. But that shouldn't be a problem for you. In whichever country you are, your medical practitioner is going to use the best medication of choice for your country. And also another medication that is used is letrozole. This letrozole is actually used in treatment of breast cancer as well, but it also helps to induce ovulation. So it depends on where you are and your specific circumstances, but in all of these, you will have a good discussion with your medical practitioner and the best treatment of choice will be given to you. So there could be other ways to manage PCOS. In managing the symptom of irregular periods, the use of oral contraceptive pills can help to induce periods. So when you take contraceptive pills, they usually use progesterone tablets. So when you take these progesterone tablets in the course of 3 to 4 months, it's going to help to induce the periods. So by so doing, that symptom has been managed. And it is very important that it is managed because it will help to reduce the person's risk of developing endometrial cancer, which is usually associated with no periods or irregular periods. So it is really a very good form of treatment for people with irregular periods in PCOS. If you've watched me to this level, thank you very much. Please do not forget to like, share, and subscribe to my channel. Now, let's go ahead to talk about the difference between PCOS and ovarian cysts. So the number one difference between the two is that in PCOS, there is high levels of the male sex hormone, which is the androgens, the testosterone. But in the ovarian cyst, there are no such problems. You don't have excess level of male sex hormone. Now, in ovarian cysts, there is no problems. Most women usually do not have any symptoms. But in PCOS, you find out that most women present with symptoms. In ovarian cysts, there is little probability that the woman will be infertile. But in PCOS, there is high probability that the woman will present with infertility. Finally, in PCOS, there is no ovulation or irregular ovulation. But in ovarian cyst, there is no problems with ovulation. Ovulation is usually regular with no problems. Thank you so much for watching. Please do not forget to like, share, and subscribe to my channel. Do not forget to give me a big thumbs up. With this, YouTube can recommend my videos to more viewers, and I'll see you in my next video. Bye for now.